Bismillahirrahmanirrahim. Assalamu alaikum. Good evening, ladies and gentlemen. I extend a warm welcome to all participants for joining us today for this enlightening webinar on board certifications and clinical pharmacy scope. I am Mehvesh Idris from Team APSU, and it's my pleasure to introduce our distinguished speaker, Dr. Rehan Anjum, a luminary in the field of clinical pharmacy. Before we proceed, I want to make a Before we proceed, I want to take a moment to give a shout out to the amazing non-profit platform All Pakistan Students Union. Their motto, Learn and Serve, perfectly captures their dedication to making a positive impact in our community. APSU is doing incredible work by providing welfare opportunities and free education to underprivileged children and youth. Today, we are privileged to have Dr. Rehan Anjum with us. His insights will illuminate the critical aspects of board certifications and the extensive opportunities within clinical pharmacy.
Oh, dear.
हेलो अस्सलाम वालेकुम। अच्छा, मुझे पहले आवाज़ नहीं आ रही थी whether it was started or not। Okay, my screen is visible. Okay, let's start this session. My name is Rehan Anjum, and I have done formed the and MS in bioinformatics, and I'm also board certified in pharmacotherapy specialist and also board certified infectious disease pharmacist. Currently, I'm working as an assistant manager clinical pharmacy at Shifa International Hospital. Moreover, I am also working as an adjunct professor at Shifa Tamil University, and I'm also the residency program director for ESHP residency program. So, thank you so much, the SSO team, and I really appreciate the efforts you people are doing, the young energetic people. That's wonderful, and I hope you would have a very bright future. So, whatever kind of support you require, me and more people like me would be great to provide you support. So, our this session that was about board certification and some scope of clinical pharmacy. So, I have to guide you about it. One thing I need a little bit support, Miss Sabira, if you can look into it, that whether if you see about myself that when I was joining, so it was saying that maximum limit was reached, that is 100. So whether we are broadcasting it or what we are doing, please just let me know. Okay, that's fine. So if there are any questions there, you will forward to me. That's fine. Okay, that's fine. Thank you. So let's start about the board of pharmacy specialties and paving the way to the professional growth. Um, so first of all, whenever we then form the with graduation, when we graduate, then we come to know that what to do next, whether I'm going to do MPhil or something else, or should I get a job or etc. So if you're lucky enough, you got a job, that's great. So now it's 9 to 5 job. You daily come to the office and leave the office at 5 p.m. So the life is passing well. So this is not something we humans are meant for. We always look to strive to improve ourselves, to improve our career, each and everything. So and truly speaking, 4 to 5 years back, when we are looking at okay, I have done Form B, I'm doing a good job. So what to do next? And the first thing comes in your into your mind that is Form D, sorry, MPhil. And MPhil in what? I'm doing job in a hospital. I will do MPhil in pharmaceutics. I will do MPhil in pharmacognosy. So going into such education system as such a degree that has no practical relevance with your field. For example, a hospital, what a person will do with that degree of MPhil in pharmacognosy at the hospital? He's not compounding any drugs. MPhil in pharmaceutics, that might be more relevant to the person who is working in the industry or dealing with the dosage forms, etc. So the thing is, the path was not clear, and we only see the only thing that was available to us was that it's an MPhil program. We have to do it, and that's just a degree, and there's no use of that degree. So the question is always there: what should I do? Trust me, there is a word known as continuous professional development. The point today I would say that you must learn about that is the continuous professional development. In whatever field you are, whether you are a hospital pharmacist, you are an industrial pharmacist, you are a community pharmacist, wherever you are in academia, wherever you are, or even if you're not a pharmacist, if you're doing some other job, you must involve yourself in continuously updating yourself. And continuously updating yourself means that you have to get new knowledge, you have to meet the new requirements, the new skills, each and everything. So you have to keep yourself updating, you have to learn new skills, you have to update your knowledge, etc. So being a pharmacist, what are the scope for a pharmacist if you are a hospital pharmacist? So for a doctor, if you say for a doctor that what's there, they have a specialized residency program. Unfortunately, in Pakistan, there are not so much residency program available to us. So there are multiple fellowships. There are a lot of trainings to the doctors. For example, you can say that a doctor can write FCPS like that. So many things. But what a pharmacist should do, our pharmacists were trying to have some kind of certifications like from the Society of Infectious Disease Pharmacists and such like different organizations. But still, though we are quite much late, but since then there are multiple credentialing bodies, and one of that is the Board of Pharmacy Specialties. The Board of Pharmacy Specialties is a kind of credentiating body that says that that credentials, advanced knowledge of a pharmacist, that is specialized credentials offered to a pharmacist that show that um,
Excuse me, sir.
not visible. ये अब visible है. No, it's
Yes, it
okay.
is visible.
Thank you so much. Please let me know if there is some problem like this. ठीक है. So board certification क्या है? Board certification, Board of Pharmacy Specialties एक ऐसी body है uh, that credentials the pharmacist to show that their advanced knowledge and expertise in a specific area of pharmacy practice. For example, like in my profile, I said that board certified pharmacotherapy specialist, board certified infectious disease pharmacist. So these are the different areas. अगर आप डॉक्टर्स की बात करें, then you come to know ये जो है वो ENT है, ये गुर्दे का डॉक्टर है, ये न्यूरो का डॉक्टर है, because they have dedicated fields. Same like that, there are specialized fields for the pharmacist where you can work, where you can show that advanced knowledge, and that advanced knowledge is also the practical knowledge. So board certification is something that is just like FCPS thing. It requires a number of years of experience, for example, 3 to 4 years of experience with advanced knowledge as well, and the latest knowledge. If you're going to become a board certified pharmacist, then you must maintain that knowledge as well. So board certification is not something that you have to do it at any cost. It's a voluntary thing, and voluntarily you are doing it. But multiple organizations want to have person from the board certified pharmacist, and um, everyone wants to say that I'm providing a very good services to my patients. Trust me, when I become the board certified pharmacist, like 2 to 3 years back. So whatever I learned there, and there was a course provided by the American College of Clinical Pharmacy. That course was awesome. That was totally practical based. Then whenever you are on the round, you are the part of multidisciplinary team. Then you would learn that okay, what kind of intervention I have to do, what I have to do now, what kind of drug I have to add, or what could be changes made into the plan of the patient. So board certification helps you to have that knowledge, to have that skills, and it also teaches you about the implementation. So board certification is advanced knowledge and expertise credentialing. And what are the benefits? So advancement in professional development, yes, there are multiple organizations that look for the board certified pharmacist. For example, if I talk about my organization, they really offer a very good remuneration and stipend kind of allowances for board certified pharmacists. And there are also other organizations that give privilege to the board certified pharmacists. So there's a career growth as well, and there will be multiple expanded career opportunities that are available for board certified pharmacists. You will see there were very few board certified pharmacists in Pakistan, but in the whole world, if you see there are multiple job positions, you can see that they are saying that we need a board certified pharmacist. So if you're a more specialized person, just like a simple doctor, MBBS doctor, and a person with the FCPS or etc., or with a specialty, there are in a handsome amount. The most important thing is that enhanced patient care. Our curriculum, unfortunately, the curriculum of Pakistan. I don't know the people are joining from which area, but I think mostly from Pakistan. The curriculum of the Foundry is usually a foundation stone, foundational level knowledge and that does not tell you how to implement that knowledge. But if you're going to learn, go for the board certification, then you would actually learn the application of that knowledge. And when you learn the application of that knowledge, you will provide very enhanced patient care to the patients, and that enhance your trust. The consultants, the team will trust you that what kind of intervention you are making, that's all very valuable. And that gives you a recognition and prestige multiple times. The doctors, the interdisciplinary team will call you, will say, will seek your guidance. And this is not a single instance. There are so many instances. I can quote of mine as well, because multiple times there were 5 to 6 consultants, and they called, where is the clinical pharmacist? I want to talk to them. So that gives you a lot of recognition and prestige. Moreover, networking, there are very good networking opportunities and collaboration opportunities internationally, as locally as well as internationally. You can collaborate with different organizations and persons. And one thing is that is a continuous professional development. While having a board certificate does not mean that you earn a degree and that's it, a certification and that's it. No, that credentialing is just for 7 years, and in that 7 years, you have to make your CEOs around 100 CEOs, and that are not continuous educational hours, or you can say training hours. It should be at least 100. But those 100 are specifically designed by the American College of Clinical Pharmacy. So you are continually involved in professional development, and continuous education is there. And industry also looks for the board certified pharmacists. Multiple industries, for example, hospital and health system pharmacies, they very well acknowledge the board certified pharmacists. Community pharmacists, though there is not any specific requirement for the community pharmacist, but there are multiple type of arrangements, where, for example, anticoagulation pharmacist, or therapeutic drug monitoring, MTM, or different type of specialized cares. So they require the board certified pharmacists, and there are multiple specialties where you can have board certification. For example, infectious disease, renal transplant, oncology, etc. You name it, and I think there are around about 17 specialties for the board certification. When I am talking about the scope, if you can see the UE website, this is, I think so, from the DOF, you can see, and there are multiple positions like pharmacist, clinical pharmacist, and specialized pharmacist. On the top, if you see the specialized pharmacist, they are saying that they are looking BSc form with Doctor of Pharmacy, and 1 year post graduation qualification, one of the specially listed 1 year experience. But the other thing is there's an American board in one of the specialties, and those are the specialties that are offered by the Board of Pharmacy specialties. So it is acknowledged by the government authorities as well, and at the regional level as well. And one thing I also want to add it, for example, people are saying that MPhil might be better for the government sector, might be MPhil is better, but for providing a better patient care, board certification is the best thing. And I see a notification from the Egyptian government, because there are a lot of board certified pharmacists in Egypt. They consider board certification as an advanced degree, and they consider it as an equivalent to MPhil, just like FCPS, that is considered equivalent to MPhil program in Pakistan. But now the board certification in Egypt is also equivalent to the MPhil program. But in Pakistan, unfortunately, there are not a lot of numbers, so we can't say. But we hope so later, after some years, this board certification would be recognized, and it would be also considered in HEC curriculum as an advanced degree. Um, but for the knowledge stream, there are two types of streams in the academia as well. There is knowledge stream and professional stream. In the professional stream, board certification is counted as an advanced degree. So if you see about different type of board certifications, uh, mostly board certification in the pharmacotherapy, DCTS, pharmacotherapy specialist. Then, like these are the board certification, ambulatory care pharmacist, BCACP, board certified geriatric pharmacy, board certified critical care pharmacy, nutrition support pharmacy, nuclear pharmacy, oncology pharmacy, pediatric pharmacy. So there are a lot of board certifications, but most of them are from the board certification pharmacotherapy specialist. Because pharmacotherapy specialist, you can say general medicine, because it includes all kind of areas from oncology, transplant, each and everything is there in BCBS. And if you want, I would say if you're going to advance your knowledge, then it's not necessary that you must have a degree to be called yourself as a board certified. Just if you want to improve your skills and or knowledge, I would say just go through this beautiful handout of American College of Clinical Pharmacy for the board certified pharmacist. It's been shown. I think so. Someone else is sharing as well. So the point is कि I would say कि लाजमी नहीं है कि आप बोर्ड सर्टिफिकेशन ही करें, लेकिन if you want to improve your knowledge, you must at least go through the handouts of board certification of pharmacotherapy specialists. This is a list of currently board certified pharmacists. This is of the last year, and you can see it's hardly 17 to 18, and currently it is not updated. Currently, 2 to 4 pharmacists are further added. So now there is around about 20 or 21 pharmacists, board certified pharmacists in Pakistan right now. So you imagine yourself that how many. I think so 20 is still more. I think so there are only 3 board certified pharmacists in Shifa, and 4 in Shokat Khanam, 1 in Tabahart Hospital. So might be it is 12 to 13 pharmacists in Pakistan, board certified pharmacists. And every organization is really would love to have a person who is board certified pharmacist, and they are offering very good packages to the board certified pharmacists. So I hope so. Many of you would be next in this list soon. So, and I will quickly go through the process, what is like this. Getting the eligibility. The eligibility is just you have an appropriate number of career years. For example, it is 3 years for the board certified pharmacotherapy specialist, and for the ID or some specialized, you need 4 years, and you must be graduate, etc. And exam is usually 2 times a year, but now it is continuous, like you can take it any time of the year. uh, they have a specific portal where you can log into yourself and could uh, make your profile and upload your documents. When you upload your documents, they will verify each and everything, and after verification, you have to pay the fee, etc. Documents are sent to the fee is a little bit high for Pakistan, because not for Pakistan, but it's all over the world. $600, that makes around about 2 lakh rupees for Pakistan. The first time fee is $600, but unfortunately, if you got failed, then you have to pay $300 to retake the exam. And after you are allowed to take the exam, one thing, the most frequently asked question from me, that how to prepare for the exam. I would say, because our curriculum is not well enough to support the practical application of the knowledge. So I would say whatever you are practicing, you must learn, and you should keep your efforts. So you must go through the course outline and see, for example, if it's a critical care pharmacy, what you have learned, try to implement it. You have to give a lot of time and a lot of energy to read this and to understand all these things. But it's not something that is impossible. You should go for it at least. And I would say if you're reading 2 to 3 times that curriculum, then you will learn a lot. And you can pass the exam. So I don't have enough time to explain it too much, but the exam is usually it contains 175 questions. Now it is around about 150 from the next this year. It would be 150, and the test format is very good. You can flag questions. There are calculator option available, mixed questions, but questions are usually tricky and practical based. So the score you have to get is that is a 500 passing score. You have to get it, and unfortunately, many of I don't think so. Around about 40%, 40 to 50% people got fail in these exams because they don't know how to score and how to maintain. For example, it's a 4-hour exam. In a 4-hour exam, you must maintain your self-control that you should not be overexcited or too disappointed. You have to be consistent and you must be focused to answer all those questions and usually get so after that you will be awarded the badges for example these are the badges and you can retake exam without less on $300 if you're taking within a year. After 1 year you have to take it the full fee. So this was all about BCPS. I have tell it all about this thing. You can further find it on the BPS website as well. Quickly, I am going through the scope of the clinical pharmacy as well. Clinical pharmacy is defined as that area of pharmacy concerned with the science and practice of rational medication use. The point is the rational medication use. And when you're talking about rational medication use, that means everything related uh, to the medication use. For example, everything that makes a medication best to use, maximum effect with the least side effects or the maximum safety. So for that thing, if you when we talk about those R's, that right dose, right route, right patient, you have to ensure that whether this drug that is right for this patient, but whether it is right for the other patient as well or not, whether this treatment is good for this patient or not, whether the kidney function of this patient are good or not, whether this dosage form is good for not. For example, a child might not be able to swallow a tablet. So this is the rational use. This is overall the role of the pharmacist, the rational use of medication. But being a clinical pharmacist, it is something that where it's a philosophical term where clinical aspect is more added and where a pharmacist more directly involved in the patient uh, care plans and some things. So, and clinical pharmacist is something that is also help to make the health system better and the academia, each and everything. For example, you have to create a lot of studies, you have to conduct research, you have to contribute in patient outcomes. And who are the clinical pharmacists? Clinical pharmacists or licensed pharmacists. And in Pakistan, if you want to become a clinical pharmacist, there isn't any dedicated education system. You can say that I have done MPhil in clinical pharmacy, so I would be a clinical pharmacist. Unfortunately, there isn't any such program offered. Shifa Tamil University is offering clinical pharmacy practice, MPhil in clinical pharmacy practice. And that is also an acceptable program. But other thing is, you might have a specialized clinical pharmacy from abroad, or you have accredited residency, for example, ASHP residencies that give you a good option to be hired as a pharmacist, clinical pharmacist, or a board certified pharmacist. So, so these are the things that a clinical pharmacist usually possess. But skills that are required for the clinical pharmacist. Unfortunately, Pakistan, there's not a lot of residency program, not advanced educational programs are available. So what usually is considered that the amount of experience a person has in a relevant field. For example, if you have 3 to 4 years of experience in oncology and you possess sound knowledge of oncology, then those people are selected as clinical pharmacists as of now. but I hope so in near future, the residency program, the board certifications, or the advanced knowledge would be mandatory. If you want to become a clinical pharmacist with skills, you must stay up to date with the literature. You must have some kind of subscription like Medscape or something related to the medical. You must know what's going on, what are the medication updates, what are the new drugs in, what are the safety alerts, each and everything. You must know what the new study said about that drug. So you must stay up to date with the literature and
Is,
G.
is, is clinical pharmacist can prescribe the medicines?
Now, I am going to answer it a little later. A little later. Okay. Ability to critically evaluate literature. You can evaluate the literature. You must know studies. Actually, the pharmacists are very poor in the researching, but research isn't any big issue. If you are going to become a board certified, you would come to know that there is a lot of topic like study design, biostatic, and research that will help you to understand to critically evaluate the literature, and you must know about it. A clinical pharmacist should have an excellent communication skill because you are part of an interdisciplinary team. So you must communicate what you want to say exactly, and you are also involved in training of other healthcare professionals as well. And so your communication skills should be very good. And I I think so. One must have a desire to educate for the patient and for the pharmacy profession as well, because clinical pharmacists, I would say, those are the face of the pharmacy at the patient bedside, and they must have a strong leadership skills as well.
Okay,
So
thank you.
I am going to answer that question about a clinical pharmacist can prescribe medication. There is a term known as CDTM, collaborative drug therapy management. That was later in my presentation, but I'm telling you that collaborative drug therapy management, that is something where that's an agreement with a healthcare professional or the physician that following services would be provided by the pharmacist. In UK, now there's a prescription code. Pharmacist is also prescribing medications. In Pakistan, it's not currently there, but there are multiple CTM contexts that have been used. For example, authorization by the pharmacist, like for example, any drugs that has to be ordered, and that has to go through the that must be approved by the pharmacist, like a prior authorization type things. And in anticoagulation clinics, there are also CDTM there, like where you can make adjustments to the patient, but it is not like you can initiate a new dose right now in Pakistan. So, clinical pharmacist main process components are collection of patient data uh, and assessment of the medication regimen, whether that regimen is fine for your patient or not, and making a development plan, a care plan for the patient, and implementation of the care plan. For example, okay, following dose should be adjusted, or following therapy drug monitoring has to be done, and then follow-up evaluation. So these are different tasks. Miss Vida, you have told me that I have to close it at 9:40, so I'm a little bit faster, going a little bit faster. If anyone need anything else, he can contact me via email. So documentation, you need a lot of documentation like medication history, active problem list with assessment, plan of care. This is something I think so you will read and you have gone through it, that pharmacy workup for drug therapy. I am very much into that form or that tool, that is PWDT, because that actually helps you to make a better decision for your patient. So PWDT, if you could find it, then that is very helpful for the patient. And this is a collaborative team-based practice and privileging. This is something I'm talking about. The CDTM is there, while you are also on the round. You are part of the multidisciplinary team. So when you're part of a multidisciplinary team, you are with the rounding with the physicians, nurses, etc. So you are giving your input. So if you are saying that pharmacist prescribing in outpatient, usually it's not prescribing, but in the inpatient, or for example, if I quote my instance. So at time it happens that I can say my consultant, sir, I think so this patient needs this medication. Orders are of the consultants, but uh, that advice is or the suggestion is from my side or from the clinical side. And the other thing is now, Alhamdulillah, our consultants are so much reliable on the clinical pharmacy that they even don't say that, okay, this patient need this drug, please give him, for example, it is vancomycin, please start vancomycin to this patient. They will not say vancomycin 1 gram BD to this patient. They will say start vancomycin because they know pharmacist is there, he will do the rest. For example, I will see that I have to start vancomycin, okay, that's fine. That patient requires vancomycin, okay, the dose should be like this, that it should be 1 gram OD, 1 gram BD, 500 mg or whatsoever. That's on our side. So so collaborative efforts where you are working with the multidisciplinary team. So moreover, clinical pharmacists are also involved in professional development and maintenance of competencies. I have told you that a clinical pharmacist should be keep his or her knowledge up to date and should involve in CPD as well. And he must show the professionalism and ethics as well because you are doing rounds and you must not do some kind of experiments. There must be something. You must have some references to say anything, to negate, to counsel, to discuss. And one thing more that is very, very much important, and unfortunately not very much in Pakistan, that is research and scholarships. So pharmacists should involve in research and scholarships, and it is very easy to do so. And there are multiple additional responsibilities, for example, clinical, like in academia or regulation, making up of guidelines, etc. So these are multiple tasks. So that's all. I think so. I have briefly explained the scope of clinical pharmacy and board certifications. If you have any questions, you may ask now.
Assalamu alaikum, sir. Assalamu alaikum, sir. My name is Daud Ahmed. I'm working in government hospital since last 4 years, and I'm working as a hospital pharmacist. Sir, can I do BCPS exam on the basis of this government hospital experience?
देखें आप बिल्कुल आप बोर्ड सर्टिफिकेशन कर सकते हैं बेशक गवर्नमेंट हॉस्पिटल क्या है अदर थिंग इज वहां पे वो जो चीज कहते हैं कि आपने इतना अरसा पेशेंट केयर में गुजारा होना चाहिए तो इफ यू आर वर्किंग फॉर द लास्ट 4 इयर्स तो आपके 4 इयर्स में आप अगर कोई भी काम करते हैं तो पेशेंट केयर के हवाले से होना चाहिए बट आई एम सेइंग अबाउट कि अगर जितना आपका पेशेंट के साथ इंटरेक्शन होगा उतना आपके लिए एग्जाम में इजी होगा इट इज लाइक अगर आपने कभी जिंदगी में क्रिटिकल केयर का पेशेंट ही नहीं देखा तो क्रिटिकल केयर के क्वेश्चन का आंसर कैसे करोगे तो यस आई थिंक सो यू हैव द रिक्वायर्ड एक्सपीरियंस यू कैन गो फॉर इट
Sir, my question was to meeting the criteria, appear criterion exam. Just like you mentioned in जैसे आपने mention किया कि PGY1 की रेजिडेंसी होनी चाहिए तो
नहीं नहीं
वो तो चीज नहीं है सर
नहीं PGY1 की रेजिडेंसी नहीं होनी चाहिए अगर आपने बोर्ड सर्टिफिकेशन करनी है तो आपके पास 3 साल का एक्सपीरियंस होना चाहिए या रेजिडेंसी 1 साल की रेजिडेंसी होनी चाहिए ठीक है
ठीक है
तो अगर आपके पास
यस
4 साल
सर थैंक यू सर
एक्सपीरियंस है तो आप कर सकते हैं या रेजिडेंसी होनी चाहिए या 3 साल का एक्सपीरियंस
थैंक यू सर बस
Okay, sure. Sir, we have a question. Suggest some updated material for BCPS from which we can study, please.
yes, the study material is available. Uh, I will share with Miss Sabira, and if you can share it with the participants. That
Sure,
is
sir.
College of Clinical Pharmacy.
Okay, sir. Next, we have a question. Can you tell us about abroad opportunities for MS in clinical pharmacy?
Abroad opportunities. There are a lot of universities that is offering MS in clinical pharmacy, but usually those degrees are not so cheap, or you have to offer a lot of money unless you get some kind of scholarships. So there are a lot of opportunities, for example, in Gulf universities, in Lebanon, in UK. So there are a lot of opportunities there, but ये ही है कि उनकी फीस जो है वो थोड़ी ज्यादा होती है.